Welcome, everyone. It's my pleasure to welcome you today. Thanks for attending today's session. So today's session is on navigating the home care funding, AHS home care funding versus the invoicing versus self-managed care. My name is Caregiver and I'm honored to be here today as your host. I'm a caregiver coach with Caregivers Alberta. We'd like to take a few minutes for the land acknowledgement. So I would like to acknowledge the ancestral and unceded territory of the many First Nation, Métis, and Inuit people who have lived in treaties 4, 6, 7, 8, and 10, and have cared for these lands for generations. We are grateful for the traditional knowledge keepers and elders who have gone before us and those who are still with us today. We make this acknowledgement in the spirit of reconciliation as we strive to support First Nation, Métis, and Inuit caregivers through respectful collaboration. I'm going to introduce our speakers today. So we are pleased with that. We are pleased to have with us today Paul Lapointe. He's an OT, MSc OT, case management practice lead, a practice development team, AHS Home Living, Edmonton Zone with Alberta Health Services. And then Elzaan Beukes, she's a client care specialist and LPN Edmonton South Qualicare, and they're here to speak with us today. So the goal of today's Lunch and Learn is to help participants, which is all of you, to understand the process of accessing home care supports and funding. So we're going to do a type of question and answer, and we'll be posing some questions that we came up with to both Paul and to Elzaan. And then at the end, we will open it up for questions from all of you. So my first question today is for Elzaan. So Elzaan, what supports are available for caregivers to assist them in keeping their loved ones at home?
First of all, I wanted to just say thank you and welcome to everybody. We're so honored to be here today. I'm so glad that I get to be part of this presentation. And so to answer the first question, the best thing that we can offer the caregivers is support. The support and keeping your loved one at home, we offer you peace of mind. So we have caregivers in place that come into your home and they give you routine and safety and stability for your loved one. Having that additional person at home gives you peace of mind so you can continue doing things that you need to do on a daily basis. So the caregivers, when they provide care, they document their visit, and families, the caregivers, all of you lovely folks, would then have access to those notes. We use a system called the Family Care Portal. And what that is you can actually read the documentation that the caregiver has provided for your loved one. So that once again gives you peace of mind. You know what they're doing with your loved one. You also have access to myself. I am the client care specialist, as introduced. Thank you. We also have our director of care. Her name is Indy. She's also a nurse as well. She's an RN, and we would work with you collaboratively to ensure that we can help you navigate the healthcare system. So support such as doctors and pharmacies and pharmacists. We can be that middle person, that single point contact to advocate and to reach all of those different individuals. We take a 360-degree approach. So what that means is that we do access all of those individuals. We don't just provide the one service that we're there for. We reach out to all of your other healthcare partners and work collaboratively as a team.
Our second question is for Paul, and Paul, it's a two-part question. And so the first part is, how does someone who recognizes they need help access home care services, and what is the general process? And then I'll pose the second question too, in case you want to answer them both together, if that's okay. And then the second part is, what does this process look like? For example, how long does it take? How long before we're approved for services? And how does home care provide these services?
Thank you very much, Carenza, and I'll echo what Elzaan said. I'm so happy to be here with you today. That is not a short question, so you'll have to bear with me as I try and give a complete answer. So as Carenza said, my name is Paul Lapointe. I work with the Home Living program in Edmonton Zone, and I do work for AHS. So I'm here representing Alberta Health Services. And the first thing I'd want to note is that as much as we are one provincial healthcare system, We also, in practice, operate very much within a structure of different healthcare zones. So I can speak quite authoritatively on practice for home care within Edmonton zone, but please take what I say with a little bit of a grain of salt when I'm speaking to what happens in other zones. There most certainly may be differences if you reside in Central Zone or North Zone or in Calgary. So I want to start out by answering the question by just kind of giving a little bit of context for AHS's home care program, because it is, one small part of what Alberta Health Services offers. Home care is under the umbrella of what we call continuing care. And continuing care is one provincial program which includes both home care as well as our supportive living and long-term care facilities. So all the different publicly funded options for individuals to receive ongoing day-to-day supports outside of a hospital environment. If you think about primary care, which is, your doctor that you see, and maybe other supports, perhaps he or she is part of a primary care network, and you think of acute care, right, with at the top of a pyramid. Continuing care is kind of that middle piece where we're providing more support than just seeing a doctor every few months, but less intensive intervention than what you receive in an acute care hospital. We are a publicly funded service, and we provide both personal care services as well as professional healthcare services for clients of all ages that are living in the community. So that means that we include children's services, right? Have a children's home care program that support children from birth up to 18 years of age in partnership with other agencies such as FSCD for family supports for children with disabilities. It means that we provide acute services. These are generally for those individuals who require professional assistance for a short period of time. So think someone who's recovering after a surgery, for example, a hip replacement, perhaps needs some short-term assistance in the home, some physiotherapy, or someone who needs a short term of antibiotics, which are delivered in their home. We also provide long-term supports for those with disabilities or chronic illnesses that require assistance on a day-to-day basis to remain independent in their homes. And I'm guessing that for many of you, that is the nature of the individual, the loved one that you're supporting, right? Is someone who has that long-term ongoing need. And of course, we also provide palliative care supports, right, for comfort and symptom management through to the end of life. When I was kind of looking up the scope of the program in preparation here, I didn't want to neglect to mention that home care also has a volunteer services branch. And depending on where you live, as well as depending on your need, there may be volunteer services available through AHS Home Care. We do try and coordinate that on behalf of the communities where our clients live, and are sometimes able to provide that friendly visitor or occasionally that assistance with transportation through our volunteer resources. So with that being kind of the context, to answer your question of how do you access this support, there are a couple of different ways to find out. Basically, you can look up, Alberta Health Services Home Care on the internet and find the phone number for your zone, or you can call HealthLink at 811 and ask to be transferred to the intake number for the zone where you live. Each zone maintains what we call a continuing care access service, or CCA, of course, because we love acronyms in healthcare. And that is a single point of access to all continuing care services for that particular zone. So CCA is a call center that provides telephone screening, needs assessment, and then referral either to the appropriate continuing care program or to often other community services that may be able to support your needs as well. Caregivers Alberta is certainly one of the agencies that we work on a regular basis with. So referrals come into continuing care access from anyone. Okay, so we accept self-referrals, we accept referrals from loved ones, right? Service is not limited by the client's age, by their diagnosis, or by the length of time that they require assistance. We do, of course, require that the person who's going to receive support in their own home consents to receiving that support, right? So if you're making that referral on behalf of a loved one, make sure you've talked to them about it and that they're actually willing to accept that support. So when you call CCA, they'll go through some intake assessments with you. You'll talk to a registered nurse and they'll ask you some questions. And then if they determine that you're eligible for home care services, they will assign that file to a local home care office that's close to where the client lives. And they'll set up a time for the case manager to go out and to actually meet with the person who needs help in their home, as well as with you, the caregivers. So the case manager will then go in and, use a comprehensive standardized assessment tool to assess the client in their home. They'll get a sense of what are this person's strengths and abilities, what do they maybe need help with, what kind of environment are they in, right? Both their physical built environment as well as their social environment. What kind of supports do they have from loved ones and caregivers such as yourself, and what can be sustained on an ongoing basis. And so one of the things that Elzaan spoke about was that single point of contact that her company attempts to provide. As part of the publicly funded system, the case manager that's assigned by Alberta Health Services is definitely attempting to fill that role as that single point of contact, coordinating services for our clients, helping our clients achieve their goals, being stewards of resources within that publicly funded healthcare system, and being advocates and educators about providing client care, okay, based on the assessed need. And I do want to stress that the services that home care provides are always based on the needs assessments that's been completed by the case manager in collaboration with other professionals, right? You can imagine two individuals, both of whom have the same medical condition, whether that's Parkinson's or multiple sclerosis or dementia, and they might require very different supports depending on where they are in that disease progression, depending on where they live, right? How accessible their environment is, what kind of symptoms they're experiencing, and just how much support they have from family and other loved ones in their life. So that's a little bit about kind of the intake process. So I know the next question was more of a multi-part one, right? What does the process look like for, getting services? How long does it take, right? The length of time between us actually receiving that referral and completing the in-home assessment is going to depend on the urgency, right, of that referral, as well as the capacity of the home care system. So my experience has been that it generally varies somewhere between same day, which is maybe a little bit of a stretch, to within a couple of weeks. Once an assessment has been completed and we've been able to work with the client and their caregivers in order to develop services, in most cases, we're able to start those services within a few days to a few weeks. But that's going to depend on the way that that individual chooses to receive services. And I think that kind of brings us into one of the main topics I know that I was asked to address today, which is the different ways that home care can provide supports. And I think it's even in the title of the session today, right, about invoicing and self-managed care. These are programs that people are really interested in learning more about. So to the question of how do we provide services? Well, first of all, AHS provides two different kinds of supports, right? We provide professional services. Those are provided directly by Alberta Health Services staff. And we go into client homes and provide those services. Or if a client is mobile and able, we sometimes have them come into our clinics for things like wound care or catheter exchange. The other kinds of service that we provide are personal care services. So these, where we provide them or how we provide them, is going to depend a little bit again on your location. In rural areas such as North Zone, most of Central Zone, Alberta Health Services employs certified healthcare aides or HCAs. And these HCAs are going to drive from client home to client home, and they're going to provide those scheduled in-home services, such as giving a medication, helping someone to get dressed or use the toilet, based on what's on that individual's care plan. In our more urban areas, such as within the city of Edmonton and the city of Calgary, Alberta Health Services has contracts with private home care companies that are bonded and accredited. And these companies provide the certified HCA staff who actually go into the client homes to provide the care tasks on the care plan that we created in collaboration with the client and family. And those HCA staff are supervised by licensed nursing professionals who work for those private home care companies. So that's what I would describe as kind of our standard or usual model of service in home care. For those of you who are already clients of home care, it's likely something you're familiar with. Most of our clients receive their services either through these in-house healthcare aides or private agencies. However, there are some other options that are available that are intended to allow clients and families to have a little bit more control over how their services are delivered and who is providing those services. So I'm going to dive into those. And again, I apologize that I'm probably talking a lot here. For these, I see people putting questions in the chat. That's great. We'll try and address those in a minute. So the first option, which is a little different from our regular care, is self-managed care. So self-managed care is a provincial program. It's available in all 5 AHS zones, although of course each zone is going to run it and administer it a little bit differently. And it's available to all eligible home care clients. And essentially what it is we go through the process of assessing what that individual's healthcare needs are, what home care can provide, and we create that care plan that outlines those care needs and tasks that need to be performed in collaboration with the client and the client's caregivers. And instead of assigning that care plan either to our in-house healthcare aides or to a private company we have a contract with, instead we sign a legal contract with either the client or the client's legal representative. And this allows home care to actually pay funding directly to the SMC agreement holder. And the SMC agreement holder then takes on the responsibility of finding and hiring caregivers who are going to go into the client's home and put that care plan we've developed into action, into practice. And they're going to pay those caregivers using the money that AHS provides on a monthly basis to them. So when I teach SMC orientation for Edmonton Zone, what I often say is, imagine that you are running a very small business, okay? And the goal of that business is to provide care to your loved one, the client, and the money that you use to accomplish that goal comes from Alberta Health Services and gets deposited into a bank account for you every month. So that gives you some idea about how the program works and what it's intended to do. A common question received, of course, is how do we decide how much funding someone gets? And the answer is it is based on that individual's care needs. For adults in home care, we look at each care task that's on the individual's care plan. and we multiply the frequency of that task. So how often does it occur, right? Maybe once a week or 3 times a day, by the duration of that task. How long does it take to provide that care? That gives us the total number of hours of care. We add that up for all of the different care tasks on the care plan, and then we multiply the number of hours by the current funding rate for self-managed care. And that, changes from time to time. It just increased to $25.02 per hour. Okay? And that gives us the monthly funding amount for the individual. So self-managed care has a lot of flexibility, but it does also mean taking on a lot of responsibility. The self-managed care agreement holder needs to be able to, recruit, interview, hire, and retain employees or caregivers who are going to go into the client's home and provide the care, and they need to be able to give direction to those workers. The agreement holder needs to have a backup plan in case the staff that they've hired are unavailable. Maybe they were sick, or maybe they were in a car accident. You need to be able to manage some business aspects. So that means making sure that the people you've hired get paid, right? Making sure that you remit taxes on behalf of your employees if you've hired people as employees, and that you're following Alberta employment standards. Now, of course, there are organizations out there that can assist you with that process. Most businesses in the province of Alberta are not actually experts in payroll and employment standards. They outsource a lot of that to a payroll services company to help them to do those administrative pieces. And you are welcome to do that as an SMC agreement holder. SMC is intended for you to hire one or more individuals as employees, but because it's a very flexible program, it also allows you to hire a home care company, such as the one that Elzaan works for, to provide services. And we'll talk maybe about the pros and cons of how that compares to invoicing. But basically with SMC, because we're intending you to hire an employee, we haven't built in a lot of the overhead into our funding rate. And so people often do find that if they're choosing to hire a private home care company, they may need to top up out of their own pocket in order to afford the rate that that company provides. And that's because the company is taking care of a lot of these business aspects that I just mentioned, right? Making sure that there's a staff available if somebody calls in sick, managing the payroll, and they might provide some additional oversight to the staff. So with self-managed care, I'd say of all the different client-directed options, it's definitely got the highest level of control over who provides the care to the client, how and when the client care is performed. Because generally speaking, the caregivers report directly to you. You're their boss, okay? You get to tell them what to do. You can tell them how to provide the care. You can get them to provide other care beyond what AHS funds, right? You're welcome to direct them as long as the care that we're funding is occurring, right? The care plan is being put into effect appropriately. We are quite happy. If you want to also have them do some other useful or fun things with the client, that's great. That's just one of the benefits of it being a flexible program. SMC also allows a lot of flexibility in terms of hiring arrangements, right? When people are looking for a live-in caregiver, when people are looking for those kind of alternate structures, SMC is often a good fit for them. And as I just mentioned, one of the benefits of that program is that it can allow you to cost share with the publicly funded healthcare system, right? Home care may not be able to provide all the funding that's required in order to support you or your loved one in their home, but perhaps with the addition of some personal funds on top of what AHS can provide, you can accomplish that goal. So that's self-managed care, and self-managed care has been around for many decades now. It's a kind of a little hidden secret, I think. But it is available in all 5 AHS zones to all home care clients. it tends to, I find, work a little better for individuals who have more care needs, okay? And especially for individuals whose care needs come in or can be made to come in blocks or chunks of care, okay? So that kind of leads us into talking about the new exciting service delivery option, invoicing, which is still in the process of kind of rolling out and developing. So this service option is currently available to all home care clients within Edmonton zone, and it's in the process of being rolled out within Calgary zone. My understanding is that there is an intention right now for it to eventually become a provincial offering, but they're just, working through our large bureaucracy to see how we can make that happen. The formal name of this program is currently Client Directed Home Care Invoicing, or CDHCI, which is a mouthful. So we usually just call it invoicing. And like self-managed care, this is a client-directed program. It's intended for home care clients who are willing and able to manage their own care, or they have an involved family caregiver who is able to direct and manage care on their behalf. And for this program, we've partnered with Alberta Blue Cross, which is in turn partnered with a number of different private home care companies, such as Qualicare, to assist in providing that service. So with CDHCI, everything I just talked about with getting onto home care is the same, right? You need to be a home care client. Your case manager goes in and performs that assessment of needs, works with the client family to develop a care plan. And then what we do is we either the client or the client's decision makers are authorized by AHS to select a care provider agency from a list of eligible agencies that Alberta Blue Cross maintains. Okay. So Alberta Blue Cross has entered into relationships with these care provider agencies, and they make sure that they meet AHS's requirements. And those requirements are basically just that all the employees who are providing care have passed criminal records checks, and that those agencies are carrying appropriate insurance, that they could do, provide compensation if something were to go wrong. Now, some of those agencies may employ, qualified nursing staff or certified healthcare aides. Some of those agencies may not. That's the choice that these agencies have. The program itself is quite broad. Okay? Alberta Health Services, Alberta Blue Cross lists those companies on their website with the languages that their staff speak and the different areas of the province that they're able to serve. The case manager, after completing that comprehensive assessment and getting services authorized, is going to talk with you or with the client about getting consent to share some basic demographic information with Alberta Blue Cross, basically name, address, hours of service that we've approved. And we send that consent off to Alberta Blue Cross, and they send you a letter saying, congratulations, you've been approved to start with the invoicing program. As of this date, these are the hours that Alberta Health Services has approved you for. We will also review the terms and conditions of the program with you and ask you to sign what we're calling a letter of agreement outlining the responsibilities and what's covered under the program. So once that's been done, you go and you pick your vendor, your care agency you want to work with from the list. You enter into an arrangement with them to meet those assessed unmet healthcare needs that are on the care plan. And of course, if you want to, you can also ask them to provide other services. The care provider agency will then come and send staff to provide care to the client in their home. And what they're going to do is they're going to bill Alberta Blue Cross directly for the service that they provide, and Alberta Blue Cross is going to reimburse that agency up to what AHS has authorized. So if I pick a nice round number, let's say that AHS has approved you for 100 hours of service per month, then Alberta Blue Cross is going to reimburse that agency for up to 100 hours per each month at the up to the maximum rate that the program reimburses at. If you choose to pay for more service above and beyond what AHS has authorized, of course, you're more than welcome to do so. Again, it can be a great way of cost sharing with the healthcare system. In terms of the relationships here, Alberta Health Services does not have a direct relationship with those private care agencies like Qualicare. So if you want us to be able to communicate with them, you might talk to your case manager about signing a consent to disclose form, authorizing some communication. Otherwise, we'll provide, assistance and teaching and direction directly to the client who's receiving care or to the caregivers, and you're more than welcome and encouraged to pass that on to the agency that you've hired. So we created invoicing as a little bit of a middle ground, right? We recognize that self-managed care had been around for many decades, but that it involved quite a lot of responsibility, right? Almost setting up your own little business, managing a payroll. We wanted something that recognized the fact that many clients and caregivers wanted the freedom to direct their own care, but they wanted something that was relatively simple, okay? So the SMC program can be complex, and invoicing is designed to open that up for a broader range of clients and families to be able to direct their own care. So compared to our regular home care service, invoicing lets you pick your care agency, right? And if you're unhappy with the service that they provide, you could always switch to another one. Okay? So there's a lot of motive there for people to provide an excellent quality of care. It does mean that because you've picked that company and you're directing care on a day-to-day basis, they tend to be quite responsive to what you want and how you want care to be provided. And it's been our experience to date that a lot of these smaller companies have more consistency of staff. You might have more ability to find a caregiver who speaks a particular language or is familiar with a certain culture that you want to support. And of course, like SMC, it provides that ability to cost share a little bit. So that is kind of the invoicing model in a nutshell. And again, when I'm speaking to people and kind of giving a metaphor, what I usually use is the metaphor of using an insurance company, right? That's really how it's set up. Okay? If you have a job and they give you a dental plan, right? You get to pick which dentist you go to in order to receive that service. They provide the service to you, and then they'll directly charge your insurance plan for the care that they've provided to you, and they will be reimbursed up to the maximums that your plan covers. If there's more costs that aren't covered, you need to pay that out of pocket. That's kind of the analogy that I would use when explaining the invoicing program. There is actually one more program. I know it's not in the title, but I wanted to mention it because it kind of fits with our theme of client-directed care, and that is the Rural Palliative In-Home Funding Program. And I wanted to mention it because I know we've got people from here all over Alberta. So that is a provincial program. It's available in the rural areas of Alberta in almost every zone. I actually think Edmonton zone is perhaps the only exception at this point. We don't have it quite up and running yet. And it's available to any person who's approaching the end of life with a progressive life-limiting illness who's living at home. That includes our Indigenous clients on First Nations communities. And really, this program is intended specifically to address those extensive care needs that happen in that very last phase of illness and support people whose intention is to pass away at home. The way this program works is, again, you talk to your case manager to get information, find out if you're in an area that is available. And if it is available, the program provides up to $10,000 in funding per person as a lifetime maximum, okay? And to provide additional in-home supports. So those might include personal care, respite, or even nursing level supports. And one of the nice things about this program is it's very flexible. You can hire almost anyone to provide the care, a healthcare aide, a care agency, a friend or relative. So the case manager will walk you through signing a funding agreement, which is kind of like the self-managed care contract, but simpler. They'll ask you to identify somebody who's going to manage the billing aspect of the program, who they call the payee. And that person is going to find a care provider to provide care to the individual who's passing away in their home. And the care provider then provides care and writes an invoice. The client or the client's family member is going to, make sure that invoice is accurate, right? This reflects the care was provided in the home. And then the payee can submit that invoice to Alberta Health Services. Alberta Health Services will deposit money to pay for that invoice into the payee's bank account, and the payee can use that money to pay the bill for that care, and then provide proof of payment so that they can submit the next bill. So that program is, again, fairly new, just in the last few years. But it has been serving already several hundred people around the province towards the end of life. And the nice thing about it is it can be set up quite quickly, and it can potentially provide quite a bit of extra care to our folks living in rural areas who maybe want to stay at home and don't have that same access to hospice services or traditional home care services as we do in more urban centers.
So Elzaan, I'm going to turn this over to you. So number 3 question is a 2-part question for you. So how can service providers, such as Qualicare, help caregivers gather supports? And what does the process look like when signing up for home care with Qualicare? And then I will also add in there, how do we pay for the services offered by Qualicare as well?
I'm going to start with what the process looks like, because that to me makes sense to start there. So when the family members or the client themselves give us a call first, we're going to ask you a few questions over the phone. Very, very similar to what the case managers at the Community Care Access will be doing. We're getting to know you, what your needs are, what your family's needs are. Then we're going to come do an in-home consultation. Now, the in-home consultations are done by myself or Indy. As mentioned previously, we're both nurses, so we will do that assessment. And then from there, we will make your care plan. So once again, very similar to what Alberta Health Services offers. From there, we work very collaboratively with the family to take things into consideration when we're finding that perfect caregiver for you. So as mentioned, we do have criminal record checks, reference checks, skills checks. We ensure that things such as gender, race, cooking ability, things like that are taken into consideration when we find a match for your loved one or for you yourself if you're the client. We then will start services. So based on that assessment and based on what your care plan looks like, let's say it's help with showering or help with more complex nursing care such as wound care management, we would do that piece and then start your services. So that's kind of the first question, trying to keep it short. The second question would be, what types of services? Was that the question, Krinza? Sorry. Yeah. So what kinds of services do we offer? So we offer non-medical and medical care. So there is a difference between the two. For our non-medical care items, they would include companionship, safety checks, light housekeeping, meal preparation, and assistance with taking your loved one to and from appointments and taking notes at those appointments as well. That's a very key point. If the family members are unable to attend those appointments, the companion or the caregiver that we send will then relay the information back to the family. Then we have our medical services, which would be done by either a licensed practical nurse or an RN, and those would be the specialized professional services such as catheter care, wound care, medication management, palliative end of life. And then we do that collaborative approach to access other resources such as respiratory therapy, occupational therapy, physiotherapy, all of those different avenues of the interdisciplinary team as well. And so how do we pay for all of those lovely things that we offer? That would be dependent person by person. And as mentioned, we would then work with your insurance companies. Each individual one covers certain things. So that would be on the family to find out what your individual insurance company offers. But then we would also work with privately paid. So if you want to just pay us, that is an option as well. And then depending on whether your home care case manager through Alberta Health Services has deemed you eligible to receive funding through either the self-managed care or the invoicing model, we would then use those services. And then like mentioned, you can pay the difference and top up if there were any additional services that the family wishes to add on top of the care plan of approved services.
Wonderful, thank you. And so do you provide, Paul spoke to a little bit about palliative care. Do you provide some palliative care as well?
Absolutely, yes. Yes, we provide palliative care services as well as dementia care as well. I don't think I mentioned that prior, but for a lot of folks, palliative, the ultimate goal is to improve quality of life. And so staying at home sometimes is the best option, and having the oversight of the RNs and the LPNs with that medical background to carry out those complex services at the home is very, very useful and very heartwarming for families to get to keep their loved one at home through that very difficult journey of end of life care.
Beautiful. The next question is posed to both of you as well. And so it'll be, Elzaan, thank you very much for providing that information. And so again, this one is regarding services from AHS as well as Qualicare. And so what is included in those services? Like, is there 24-hour care? What if somebody needed their sidewalk shoveled, for example? Would that be something that Qualicare could provide for them?
At this time, sidewalk shoveling is something that we could explore. Once again, it's based on the individual need. So without seeing the environment, it's hard for me to say, yes, 100% we can, or no, we can't. It would be based on the individual assessment, because we do take things like safety into consideration, the safety of the client, and of course, the safety of our staff members as well. So we'd have to review those on a case-by-case basis. But we do offer like housekeeping, laundry, things like that within the home. Outside of the home is something that we can definitely explore.
Awesome. Thank you very much for answering.
Of course.
Okay, then the next question 4, I'll pose to Paul first, and then I'll pose to Elzaan if that's okay. So what exactly is included in AHS services? For example, 24-hour care, the shoveling of the sidewalks, housekeeping, financial health, nursing care, type of nursing care, occupational therapy, physical therapy, social work, etc.
Thank you, Caregiver, for the question. So Alberta Health Services Home Care has a primary mandate to partner with our caregivers to support personal care in the home and professional services. We do not have a mandate to provide 24/7 one-to-one care. That kind of 24/7 safety and care provision is the mandate of those other parts of the continuing care system, supportive living or long-term care. So what does personal care and professional services mean? Okay, personal care primarily means what we often call activities of daily living. So these are medically necessary services to allow someone to remain safe and independent in their home. They involve things like helping someone with dressing, their personal hygiene, their toileting, taking medications. What I usually say to people is these are the kinds of things that involve actually having your hands on, touching the person, or very close to them, right? They're very intimate types of activities. Generally speaking, home care is not able to provide assistance with what are sometimes called instrumental activities of daily living. These are those other tasks that provide support, and they're necessary in the long run to keep someone in their home, but they don't involve that kind of direct physical contact. So that's where your question about things like snow shoveling come from, right? So yard maintenance, snow removal, meal preparation, house cleaning, financial or legal management are unfortunately generally not things that home care can fund or assist with directly in most cases. So what we will try and do is we'll attempt to link you with any community access that's we're aware of, volunteer services, other government or municipal programs to provide funding for those kind of services to help support you. We'll do some resource, finding some direction, but it's not something that we're going to be authorizing ourselves as AHS. And of course, the other side of it is that we provide those professional services. The variety of professional services that is going to vary somewhat depending on where you live in the province. And of course, generally more options in larger centers. But generally speaking, AHS Home Care always has nursing, occupational therapy, physiotherapy, and social work services available to help our clients and caregivers and go into the homes. Within Edmonton Zone, we also have a variety of other professional services that we can provide, including recreation therapy, respiratory therapy. We can consult with dietitians, pharmacy, nurse practitioners, as well as care of the elderly physicians. So there's a wide variety of professional services that you could potentially access. And it would be a matter of speaking to your case manager and explaining the need and seeing whether they're able to support directly or potentially they can help refer you to, another service.
And then Elzaan, I'll ask you the same question.
So we definitely do provide 24-hour care. So that is a big plus for family members. We don't do live-in, however, but we can find staff to be there 24 hours around the clock. We do not help with financial matters or legal matters at this point. We don't have any professionals that would be trained to do so. So that is definitely something that we echo with AHS. We don't provide those services at the time. We do have all types of nursing care. So similar to Alberta Health Services, we do offer palliative care, dementia care, wound care, complex nursing care. But then we do the light housekeeping and the laundry and the, like he said, instrumental acts of daily living. So we do offer help with those things, meal preparation, and we would work within the home to get those services completed.
Thank you. The next question will be, Elzaan, seeing as you're in front, I'll ask you if that's okay. So how do we pay for these services or supports that Qualicare offers?
Thank you for the question. So how we would pay for those services, we have a couple different options. So the first option would be for the family to pay for our services out of their own pocket, would be the first option. The other option would be to work in collaboration with the approved services that they already have through Alberta Healthcare, depending on whether that was the invoicing model or the self-managed care, as well as we could loop in any insurances such as Blue Cross and direct bill them for coverages that you may have.
Perfect. And then Paul, I know to both of you, we sort of addressed this throughout this session, but I think it's important just to ask it again. So Paul, can you just go over how do we pay for services with AHS?
The services which are provided directly by Alberta Health Services are generally free. Okay, so there's no cost for our professional services. There's no cost for services provided by our in-house healthcare aides or by our contracted agencies in areas where that's offered. Like I said, our kind of standard service delivery model. However, your case manager may refer you to services that do have some kind of cost or fee with them. So for example, our adult day programs are a popular option for providing respite to caregivers, and they do have a small fee associated with them for the purpose of, providing meals and things like that. We often connect and refer people to external services such as Meals on Wheels, which do have a cost. And there are things outside the scope of our program which people may need to purchase privately, such as the supplies, right? So the nurse who comes to your house and provides wound care, you're not going to be charged for that. But perhaps the wound care supplies, there may be some fee or cost share component associated with that. So in terms of, and I should say, of course, with the different client-directed programs that I just mentioned, each of them are going to fund up to a certain maximum monthly dollar value or maximum number of hours and hourly rate. As long as you stay within those amounts, there will be no cost to you. However, if you choose to purchase more service than what AHS has been able to authorize you for, that's when there would be a cost to you as the client or the caregiver. So it's something to be very aware of and cautious of when you're choosing those models, that there is a potential financial risk, and you need to, approach that with eyes open and make sure that you're monitoring and have appropriate oversight. In terms of funding sources for those things that aren't covered by AHS, I'd echo what Elzaan said. We encourage people to look into what private insurance might offer. We try and connect them with other programs such as Veterans Affairs, WCB, AISH, Alberta Aids to Daily Living, or the Alberta Seniors Benefit Program, to try and see where they might be able to get funding, and just to make certain that they've maximized the financial support that they're able to receive. And as I mentioned, social work is one of the professional services we provide. And so if we would like, you could always talk to your case manager about getting referral to an AHS social worker who would complete a financial assessment with you or with the client to help ensure that you are receiving all the different benefits that you might be eligible for.
One final question, and this one is directly for Paul. When is the invoice model being rolled out in Calgary? Do you know?
My understanding is they are in the very late stages of preparing for their rollout, and they are expecting a full rollout by the end of 2022.
Thank you for that. And thank you today for coming.